I'm Mike Thompson. I'm a hematologist oncologist at Aurora Healthcare in Milwaukee, Wisconsin. We're talking about cancer multidisciplinary conferences and some of the pain points in having some of these conferences. One of the potential issues is having a feedback loop. So you may have a case that's presented, it's discussed, but there's often not a easy mechanism to obtain feedback to see if what was suggested was done and if all of the various types of groups contributing to a decision were involved. And so a feedback loop can be facilitated potentially by a cloud-based platform that's asynchronous, in which if someone's out of town or someone's busy in surgery or someone can't make a meeting, they can check in before or after everyone else has talked and give information. And this feedback can also be extended to include experts that may not be either in that local site or in that health system, especially for rare tumors or tumors where there are limited clinical trials available in certain sites in the United States. I think what I've seen of Dr. Weber's approach does allow some feedback and that expertise, but trying to extend that to other tumor types and to an asynchronous model is of potential benefit.
So the way we address the problem as far as feedback loops is really by our ability to talk to each other offline after our multidisciplinary conference, whether that be email or on the phone. Though the fact of the matter is we go through so many cases that the only way to really do that is to represent our cases, and that's really how we use our feedback loops. However, being able to have this established such that people can log on and log off, and as things change, it makes our decision making more mobile and really better overall if we were able to do that rather than just waiting till the next week or until we call or email, which really takes it from being a multidisciplinary tumor board to being a tumor board between two specialists over email or calling. So I think a lot gets lost in translation in emailing and calling, especially when someone is somewhere else and they can't see the images, they don't remember exactly what we were talking about in the tumor board, and they really can't have the other specialists chime in, which is, I think, the important about multidisciplinary tumor board is the fact that everyone is on, everyone can hear the points that each specialist is making. And when you take it from a multidisciplinary tumor board and make it just between two people over the phone, and you really miss out on everyone else's thoughts. And just because they're a radiation oncologist or a medical oncologist or a surgeon doesn't mean each of those people don't have an opinion on the role of the other subspecialty in the overall treatment. So I think it's really very important for everyone to be together to chat about it and to chat about what the next step is.
Online platforms, especially ones that are asynchronous, may help with a variety of issues in multidisciplinary conferences, including timing, scheduling, sharing of images and other files such as pathology, as well as providing a feedback loop to allow the various constituencies participating in these conferences to share information. And it can also be a mechanism for learning over time, both for the physicians as well as students.
Tools like Medting, powered by Best Doctors, can help create a reliable feedback loop on diagnosis, treatments, and outcomes that traditional multidisciplinary conferences do not offer. Visit bestdoctors.com/Medting or call 855-361-3800 to learn more about Medting or to schedule a demonstration.